To each and every one of you joining us today from around the world, a very warm welcome to the world's largest conference on lung health, the Union World Conference on Lung Health 2022. Thank you for joining us. As the world continues to battle COVID-19 and TB, combating pandemics has never been more important and relevant. We also strive to ensure we avert future pandemics, and we believe that together we can. Without further ado, we present the opening ceremony.
Distinguished members of the Union and conference participants, welcome to the Union World Conference on Lung Health 2022. I would like to begin by acknowledging the traditional custodians of the land on which I am standing today, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present, and emerging. I extend that respect to First Nations people who are present with us today. While I am disappointed that I will not be able to welcome you in person to this year's conference, I am pleased that we're able to host a conference that is accessible to all. We took the decision to hold this year's conference virtually in recognition of the reality that the COVID-19 pandemic is not over. We are a global conference and place a high value on holding an event that is inclusive, accessible, and safe for all. Thanks to your valuable feedback over the last 2 years, we have refined our interactive global virtual event this year, and I am confident it will be an excellent platform for exchange, cooperation, and innovation. The theme of this year's conference, Combating Pandemics Today and Tomorrow, is a timely reminder that we can't wish the pandemic away. COVID-19 is causing severe morbidity, including long COVID and premature death, particularly in those who are vulnerable. COVID-19 remains a huge challenge. We must tackle it together. As we meet towards the end of 2022, we recognise that we still have much to do to achieve our vision of a world free of tuberculosis and lung disease. Now, almost halfway to the 2030 deadline to end TB, we are faced with a choice. Either abandon the goal or revise and reinforce the strategy to get us back on track to achieve the goal. For the millions of people suffering and dying from TB each year, and for everyone attending this conference, there is only one option. At the Union, we believe the goal of eliminating TB and lung disease is vital and achievable. However, it requires us to refocus our efforts, use new tools and knowledge, and reinvigorate the commitment to end TB and lung disease in the near future. This is why I am so proud and excited to be opening the Union World Conference on Lung Health 2022. We have produced an exciting and inspiring scientific program covering many aspects of lung disease, including TB, COVID-19, COPD, asthma, and pneumonia. We will continue to highlight the harmful impact of air pollution, tobacco, and climate change. After its great success last year, Union Live will again feature thought-provoking sessions, including a deep dive into WHO's Global TB Report and Stop TB's Words Matter, focused on the use of empowering TB language. You will also hear powerful community voices in our open access space, Community Connect, helping create a robust link between people most affected and the emerging science. An exciting new addition to the program this year is Youth for Lung Health, which aims to create the conditions for young people to lead the agenda and influence the lung health ecosystem. I would like to extend a special thank you to our sponsors and partners for their invaluable support of the Union Conference, especially during these virtual years. I would also like to express my gratitude to the Coordinating Committee of Scientific Activities, led by Dr. Kari Tudor, the Union's Community Advisory Panel, led by Ingrid Sherman, and the Union's conference team, led by David Jackson, who have worked tirelessly throughout the year to bring you this online experience of new science, research, treatment, policy, and networking. I wish you all a successful, rewarding, and enjoyable week at our virtual conference. Together, I believe we can achieve a healthier world for all, free of tuberculosis and lung disease.
Greetings to all the esteemed guests and delegates of the Union Conference. I'm Olya Klymenko, a TB survivor and chairman of the board TB People Ukraine. For me, it is an honor to be part of the conference and to be here. The whole of the world is making a tremendous effort to end the war in Ukraine, and for Ukrainians to survive in this fight, it is hard to talk about fighting TB and COVID-19 and raising the voice of the community. When you see all the tragedy that the war brings to my people, all the deaths of innocent people, in particular the number of children who are dying. But I have been trying to pull myself together and find the right words for team and find the strength to continue the activities of TB People Ukraine. As behind us there are thousands of sick people and health workers who need our support. The truth is this: for the world to start acting, it has to be pushed. Every one of us, and I'm sure every politician, understands the importance of certain activities, in particular activities aimed at the health system strengthening. But for people to do something, they need a strong push. One such push was the COVID-19 pandemic. Now it is the war. The world will never be the same, but even this new world, people still die of TB. This year, the message of the Global Fund campaign is "Fight for what counts." I fight for the future of our children without TB, without wars, in a world where the human right to life and health are not empty words, but a cause for action. We all understand that we need prevention program and improved access to treatment for all countries. In Ukraine, our hospitals were bombed. How do we treat the millions of sick people then? We need to change our thinking and be committed to providing health services even though the hospitals may not be there. Let us build a robust system of services together. As we have seen that as we are united and coordinated, there is nothing impossible for us.
All of us are aware that the COVID pandemic has been devastating for tuberculosis. We are unlikely to meet our TB targets. Given how slow our progress was in the past and how much we've fallen behind, honestly, it has been a struggle to find hope and optimism. But I believe Dr. Paul Farmer's life and legacy has some key lessons for all of us. His work could give us some hope and guidance. Paul taught us that in global health as a field, we are all socialized for scarcity on behalf of others. By that, he meant that we often set a low bar for poor compared to ourselves or people who are privileged and wealthy. That we often decide that we can only do some things but not other things. We pit one disease against another. We push control over care, and we emphasize public health but do not center enough on people who are most impacted. I'm sure Paul would agree that TB is a textbook case of what he called socialization for scarcity on behalf of others. I think we all suffer from this. Even today, we are socialized for scarcity when we assume that TB budgets are fixed and therefore we cannot implement all of the effective interventions that we have. We are socialized for scarcity when we continue to use century-old tools like smear microscopy or BCG and do not demand for better tools. We are socialized for scarcity when we think that new drugs and regimens and molecular tests are too expensive to offer to all people who need them. All of us in TB have to intentionally struggle and fight against the socialization for scarcity. Paul showed us that with struggle and with effort, it is possible to bend the arc. He and his team successfully managed to scale ARVs and drug-resistant TB treatments to millions of people in the most resource-limited of settings. He managed to find the staff, space, and systems and support even in clinical deserts, as he called them. He showed us it is always possible to center on people and the most impacted communities, and that it's possible to work in solidarity with them, even if we are technical people or medical people. Most importantly, Paul's life is a clear illustration that we can overcome what he called failures of the imagination. I hope we can all be bold in TB to imagine and set a much higher ambition for TB than we've ever done before. That we can imagine a world where everybody, regardless of where they are, how rich or poor they are, can get the best quality care, the best available tools that we have at our disposal, that we can have much better vaccines and tests and drugs than we have today. And I hope we can finally imagine and demand a budget that TB really needs in order to implement the full complement of interventions that we require, including social determinants, for us to end the TB epidemic. To realize this dream, all of us working in TB, like Paul Farmer, must, I think, also become advocates for social justice. Advocacy is not something that we need to shy away from. And we must take our lead in advocacy from TB survivors and TB communities because they have the lived experience that many of us do not have. With struggle, I'm sure we can bend the arc to end the TB pandemic. Thank you for this opportunity.
Nous devons nous battre pour regagner le terrain perdu à cause du Covid-19. Nous devons veiller à ce que les gens aient accès à des traitements antituberculeux décentralisés, à des services de conseil et à des formations. Et tout cela doit être renforcé par des plans d'action nationaux chiffrés des CRG de la tuberculose et une action multisectorielle engagée.
Ang kawalang akses sa pag-iwas sa TB ay isang paglabag sa ating karapatang pantao. Ang lahat ng bansa ay kailangan mangako sa pagpapalaki ng TPT at pagtaas ang pagiging kwalipikado. Humihingi din kami ng N95 respirator para sa lahat ng magagawang pangkalusugan.
There is no space for data diagnostics anymore. Early diagnosis saves lives. We need an equitable, accessible, and operational TB vaccine now.
जब छोटे और सेफ ट्रीटमेंट कोर्सेज उपलब्ध है तो लंबे और टॉक्सिक ट्रीटमेंट क्यों दिए जा रहे हैं? हमें लोगों की अनावश्यक दर्द और पीड़ा को खत्म करना ही होगा और ओरल शॉर्टर ट्रीटमेंट देना बहुत जरूरी है.
Kwa nini tunawaacha watoto wetu nyuma? Tuna deni kwao kuwapa maisha ya utotoni yenye furaha yasiyo na maumivu. Lazima tujitolee kuziba pengo la TB kwa watoto na kuunganisha huduma. Lazima tuhakikishe ufadhili wa kuchukua hatua mahususi dhidi ya TB utotoni.
Coloque seu dinheiro onde está nossa voz. Não podemos acabar com a tuberculose sem financiar as comunidades que fazem esse ativismo. As comunidades estão melhores preparadas para dar uma resposta e um suporte à pandemia de tuberculose. Nossas vozes são de extrema importância. Precisamos que nos financiem para que consigamos fazer esse trabalho de extrema importância.
Ми не наблизились до цілей, поставлених зустрічі високого рівня у 2018 році. Усі країни повинні взяти участь у зустрічах високого рівня у 2023 році і взяти на себе зобов'язаність видати більше фінансових ресурсів для подолання туберкульозу. Нарешті ми не можемо покінчити з туберкульозом, не покінчивши зі стигмою та дискримінацією, та не забезпечивши значущої взаємодії з громадами. Нічого.
Hakuna kitu.
कुछ भी नहीं.
Wala.
Rien.
Nada por nós.
Nothing about us without us.
Thank you to all our distinguished guests for your important messages. The Union World Conference on Lung Health 2022 is now open. Thank you for joining us.